value that we place on community is very important. We're about much more than providing medical care or dental care in four walls of a clinic. We're out on the streets. We're in people's homes. We're talking with homeless youth. We're in the community organizations that they're tied in with. And that is the real legacy of the community health centers. And I think it's one of the most fundamental things that we offer to the healthcare system in the future. It was no accident that the community clinics grew out of the civil rights movement and out of the anti-war movement. And there was a belief in that point in time that we could change and would change the world.
In those days, the idea that you would have a small clinic in every neighborhood and that you would open the door and make services free or on a sliding scale was pretty radical stuff.
But it wasn't just the clinics. They were part of a whole movement that was looking at the structure of society, the way that decisions get made, the way that resources get used. The 60s and 70s were a time of assessment, reassessing what people held to be true.
And it's that spirit that is still alive in the community clinics today. And as I listen to the stories of new staff members just joining the organization, what I always hear about, invariably, is their commitment to that theme of social justice.
There's a different kind of reward when you care for a patient that wouldn't be able to get that care any way or anywhere else.
It's simply values, and the values of the people that work there. And they are heroes, and we stand on their shoulders.
It's something that I can relate to with my personal values and my professional skill. I don't know a lot of people who are as lucky as I am where they get those two things coming together and get to do it every single working day.
And the community clinics, and I've been in a number of them, do an excellent job of showing you the face that you are as you walk into the clinic.
The staff, I think, has a real commitment to the cultural sensitivity of its patients. Because what I need is different than what a teenager needs, which is different than an immigrant from Africa needs, which is different than an elderly woman needs.
Those patients, they get good care, and I'm there to make sure they do.
And we've come a long way in 40 years. We're a lot more sophisticated. We're a lot bigger. Last year, we provided care to over 44,000 people. We provided 180,000 visits. So the scale of what we have become was unthinkable at the time.
I think it's been a great success story across now a couple of generations. Until America steps up and fixes the healthcare crisis, it's going to take partnerships like the one between the City of Seattle and Puget Sound Neighborhood Health Centers to fill the gap.
You know, we worry in healthcare, sort of the traditional mainstream healthcare right now, that we're building buildings, we're committing to new diagnostics, we see what's going on in the biotech field, and we get all excited by that, and we just quiver and quake, and we just think that's so cool. It's really not that cool. The fundamental needs of the human society or human community is really around health, family, nutrition, just the basics in terms of getting it done right.
And that's what we do. It gets back to this idea of providing a healthcare home for people. A home is about a long-term relationship. Home is about a safe place. Home is about a caring place where you're really embraced, where you're known.
Dạ, bác sĩ cũng tốt, phát hiện cho tôi.
They're very special. When I came to Rainier Park, the first thing I worried that they don't have the interpreter, but they do.
Each one of them are so caring that you don't think that you are in a clinic. You feel like you're in a house. And the family members are talking with you and they are caring about you and inquiring about you.
I don't feel like I'm being judged, that I'm still treated like a whole person.
And that's a place that's like home because they're caring about your nutrition. They're caring about how you live, where you live.
Everybody knows her by name. so she feels at ease when she walks to the clinic.
And when I'm sick, I make a phone call. I will want to be seen today, and they always say, yes, you can come anytime.
I feel better when I get there, and I leave. I feel better.
And that's what we stand for, uncompromisingly, 100% access for everyone in the community. We're not going to do it on our own, but we'll be a force in that direction. And zero health disparities. We will not stand for disparities that are based on these specious factors. It shouldn't matter your race. It shouldn't matter whether you are rich or poor. You deserve to have health. Everyone in our society deserves that. And that's what the community health centers are all about at their core. That's what we stand for.
Nhịp vô.
Căn nhà.
Ta với nhau.
Mi casa.
Nhà của tôi.
My home.
My home.
My home.
My home.
My home.